Ate for lunch with the doc today. Sorry about that. It's 12:37, so we have come to this wonderful place called Kitchen in the Canyon, and it's an awesome restaurant. You can see how busy it is. All kinds of people know about it now. Great food. They really cater to a natural cuisine, and they also understand people that have food restrictions and food choices that are healthier than other places. So people that want to eat gluten-free, corn-free, things like that, they have a great menu. I've actually tasted their food before, and we're going to do it here today. And this is the second part of the study on whiplash, and we wanted to talk a little bit more. If you watched last week, you'll know more about where we're at. I'll give you a brief little review, and then talk to you about how to avoid having whiplash, but also if you do have a whiplash, how to treat it, and if you have an old chronic whiplash, how to treat that and start to get feeling better so you have less and less pain and more activities in your life. Somebody already typing in?
No.
All right.
Just viewing.
All right. So anyhow, come on over. Let's talk.
All right.
So
hello, everyone.
Are you gonna go order right now?
Yeah, I'll go order for us. Do you want to take? Let's go inside. We'll all order inside.
I'm actually having just bone broth.
Oh yeah. Okay, I'll order. You come.
I'm on a little bone broth cleanse.
Oh,
so
right.
We cook the chicken bones for. We have organic chickens that we use. We use all the bones and scraps, and we boil it for usually about 36 hours with some celery and some garlic and onions, and then slow boil for 36 hours with a little bit of vinegar in there just to help the bones soften, but you get all the nourishment out of the bones. And but then you can do a really great cleanse on bone broth. I just did eight days on it back in the end of August, and it was phenomenal for me. Lost a bunch of weight, got thinking clearer and clearer. It was an awesome deal. So my son and I are doing it again.
It's probably kind of funny for everyone out there who watches because we're always on some different health thing. Either I'm only eating fruit, Dad's just having bone broth. I'm not anymore, so I'm excited about that. I can get some real food. Woo-hoo. All right. Well, it looks like the canyon salad looks really good.
Did you eat already, Aria?
There's also a burger. So why don't
Did you get money from the clinic?
I do. I have some money, and I will order, and then, okay, what do you want? What does the woman behind the camera look like?
I don't know. I'll look and you guys can.
All right. I will bring it out for Dad. Okay. Dad, let's go outside and start. And Aria will order for us.
Okay.
What do you want to get?
Just both good looking.
It's a beautiful day in Laguna Canyon. I love it.
Yeah.
We got this great view. Beauteous. We're in the canyon right by the sawdust. Laguna is just so gorgeous.
Should I do it this way?
No, it's perfect.
Or do you want to look out that way with that behind us?
I think this is good.
Okay, good. So we were talking about whiplash, and did you know that 1% of the world's population suffers from chronic pain from a motor vehicle accident?
Wow.
1% of the world's population. So if we did the math on that, last count I think there was, is it up to 8 billion now? But you think of 1% of 8 billion?
Mm-hmm.
Isn't that 800 million people or something? I don't know. I can't do the math right now in my head like that. But anyhow, 80 million people, something like that. So it's something that affects a lot of people.
Mm-hmm.
The other study says that that 25% of the people that have had a whiplash will have chronic pain from it, and 10% of those people will actually have it for the rest of their life. But here's the good news. When you understand what happens in a whiplash, which I wanted to explain to you briefly without getting too much like a neuroanatomy class, when you understand what the injury is all about and where the pain comes from, and then what the research says actually helps to decrease the pain, what they found is a 90% recovery from a certain type of treatment from these people that have chronic pain. 90% of them get better.
Wow.
So it's pretty cool. So it doesn't mean that it's, it's just your way of life for the rest of your life, because if you do suffer from chronic pain, there's answers, and research says that it's that way. So quick little story about, I didn't even want to be a chiropractor, and after I was in a really bad whiplash, I told the story last week, so I won't tell it in detail, but I was hit from behind, and I got quite a whiplash. And after about 5 treatments, the insurance adjuster said that if you want to have your car paid for and your sailboat paid for, then you have to sign off that you're not going to receive any more care. Well, here's a 21-year-old kid without a car. So I decided, okay, I guess I'm feeling okay. And I asked the chiropractor about it. He says, really, it takes 12 weeks to actually heal from this kind of injury, and it's during that time where your body lays down scar tissue, and you have to keep it moving during that time. If you don't keep it moving during that time, you're going to end up with a big wad of dense tissue called scar tissue, also called fibrotic adhesions. And your neck is going to heal in an abnormal pattern, which is going to lead you to be one of these people that's going to have chronic pain. Well, at that time I was 21 and I needed a car. I was in college, and I don't know, I didn't know much about chiropractors. For some reason, I just had a negative connotation. I think maybe my upbringing of watching Marcus Welby, MD, and the only real doctors were medical doctors, and a chiropractor, what is that? And so, anyhow, I didn't take his advice, but I ended up having a lot of problems for the next 5 years. My problems got worse and worse and worse, just like he warned me. And I had chronic neck pain, chronic mid-back pain, and horrible sinus problems that I didn't have beforehand. And so it was really neat to finally find someone that explained everything to me and asked me if I wanted to get rid of my symptoms. I said, well, yeah, that's why I'm here. And he goes, do you want them to be gone for a day, a week, a month, a year, forever? What are we trying to do here? I said, well, I'd like them to go away forever. He goes, okay, well then let me try to find out what's really causing it. And when he did the exam and took my x-rays, he showed me that the injury that I had from that whiplash was my neck was stuck in an abnormal posture. So let's talk about posture. Let's talk about the injury real quick. Last week.
Tell us a little bit about what we talked about last week, and then what we're moving into today. Moving in. We have our lovely little spine here. Oh, how beautiful.
I got my bone broth.
He's got his bone broth. He got the spine.
In my Stanley thermos. You gotta love a good Stanley.
It's true. He gave me a Stanley for my birthday, so inside.
Thank you.
All right, so good. Last week we started our whiplash series, and we wanted to do a whole series on this because it's such a big topic. We all know someone who's been in a car accident. It's either been ourselves or someone we know, and the effects of that are huge and can be long-term life effects. So we just really want to give you guys the tools and the information to help prevent that from happening, and to know what to do if you do get in a car accident. Because sometimes we can think, I'm going to be okay, I'm fine. But the effects can be so much greater than what we think. So we're just giving you the tools and information to figure out what you need to do. Last week we talked about prevention. This week we're talking about...
Headrest needs to be within an inch of the back of your head.
Exactly.
So make sure you adjust your headrest up, so you're no more than an inch of travel.
We talked about wearing your seatbelt. We talked about
things that make the injuries worse is the headrest not placed right, seatbelt, and we also found that if you are fortunate enough to be aware that the injury is coming, awareness is really important, because if you're relaxed, you don't even know it's coming, then the muscles can't protect your joints from getting more injury. So if you see it, just kind of crunch down and give yourself protection,
Yeah.
And then the other thing is, if your head is rotated at all, if you get whiplash with your head rotated, it's going to be a much worse injury as well. So it's much better if you're looking ahead. If you had an injury where that wasn't the case, where you didn't know it was coming and your head was turned, then that's even a greater injury. And then the last thing about that is vehicular damage. Well, vehicular damage means how much damage was done to your car. We talked briefly about that last week. The insurance companies have this term called minor injury soft tissue. And the research shows that the amount of damage to your vehicle doesn't have anything to do with how much damage you end up receiving in an accident. But they still use it, and they always try to keep, if there's the opportunity to keep the damages less than $1,000 to your car, then they kind of write it off like you couldn't have had much of an injury. But there's no research that actually shows that. There's tons of research that shows that your damage is not related to the damage to your car. So that's an important part to know.
So that's a little bit about prevention, a little bit about what we talked about last week.
If your car moves more in an injury, let's say it has spring-loaded bumpers, then it's going to be a greater inertial injury to you. Inertia, what is inertia? Well, Sir Isaac Newton in the 1600s talked about inertia and gravity, and what he found is that the greater that they're, like if you get hit from behind, the thing that's going to happen is that inertia is going to go through here, but your head and neck are kind of sitting in space. It's your mid-back that's associated with your seat. That's why when this gets jolted forward, this is going to come backwards real fast. So that's called an inertia injury, which is a much greater injury to your body.
Interesting.
So
that's a little bit about prevention, right? And then today we're going into kind of what happens when you're in the accident, what kind of happens to your body and in that process. And then next week we'll talk a little bit more about the details of getting treatment.
This is a plastic spine, and there's different parts of the spine. This is where your spinal cord comes down from your brain, comes right down through this hole right here, and then the spinal cord is protected by the spine. These are the spinal nerves as they come out, and there's a normal curve to your spine, and the weight of your head is that of a bowling ball. It's actually 8% of your body weight. So last week I brought the bowling ball to show what a 137-pound woman's head weighs. It's really heavy. You would never think your head weighs that much because we don't really feel it. But if you think about getting hit from behind, and let's just go through this real slow. Bam, this goes here, and this goes wham, and then forward. And what it does, it can tear the tissue alongside of your spine in between here. These joints right here, do a close-up. These are called the facet joints. And these facet joints are the things that are most commonly injured in a car accident, and they're the things that cause the most pain. Now, it is also, what helps these the most is an adjustment. The adjustments actually affect the facet the most, and that's why 90% of the people suffering with pain get relief when they receive adjustments, because the adjustments help to mobilize the facet and turn down the pain pathway in the facet and help to break up the scar tissue and get things moving again like they're supposed to. We also talked about if your neck heals like this instead of like it's supposed to be like that, that's what your curve is supposed to be like. But if yours heals like this, then the tension, you're going to get most likely get headaches, neck pain, even lower mid-back pain. Because when your head goes forward, that weight comes forward and it manifests spasm and tightness all the way down your spine. Most people with low back pain have this phenomenon where their neck is too far forward and it's causing spasm all the way down the spine. So that's kind of what happens in a car accident. And if you're hit from behind, it'll put the forces that way instead of just this way. And if your neck is rotated, again, if your neck is rotated like this, and now you go like this, bam, one side is going to be injured much more than the other. So that's what's happening. Now, we also talked last week a little bit about the stages of an injury and how to manage it, and how to make it so you don't have much of an injury. So here's what we found out, is that the first 3 days you get inflamed. So if you ever have an injury, the best thing to do is not get in a hot tub, but it's to put ice on the area, 20 minutes on and 40 minutes off for the first 3 days. Any care that you receive then should be designed to decrease inflammation. But beginning day 5 after an injury starts the repair stage where your body starts laying down scar tissue for the next up to 12 weeks, the research shows. That's why it's so important to keep things moving while they're healing, because you want to avoid that meshwork of scar tissue that's so thick and dense. It's like gristle. If you ever tried to cut through gristle in a steak, it's really thick and it's hard to cut through. That's what happens to us after the injuries.
Oh, interesting.
So there's a certain way to manage it. You manage it with exercises, with stretches, with deep massage, with physiotherapies, with different modalities. We use electromagnetic frequency adjustments, those kind of things to keep it moving while it's healing. If you keep it moving while it's healing, you're a lot less likely to have a lifetime problem.
Yeah.
It's just those people that go, oh, I'll be fine. But last week we also talked about that many people don't even start to show that they have symptoms show up until 2 to 3 months after the injury. By that time, they may have already signed off saying, oh yeah, I'm fine, I don't need any care. And the insurance company will say, here, we'll pay you $3,000 and we'll just close the case up. Well, then it ends up that it's not enough and they need a lot more care than that. So just watch it. Of course, you can use an attorney. We have a good reference attorneys that we use, and that's all available. So anyhow,
Yeah.
what else do you think people want to know about this?
So I'm thinking, if you are in an accident, what are just like your basic maybe 3 to 5 steps? It's like, okay, I just got in a car accident. 1, 2, 3, boom, boom, boom. This is what I need to do.
Number one, get their license and call the police immediately and tell them you think you've been hurt. Okay? Even though you're not sure yet. I'm kind of stunned, but I think I was hurt. That will usually bring a policeman out. Make sure you get a police report. Make sure you help to determine whose fault it was. Awesome. Thank you so much. We are featuring your place today.
Yeah.
Love your food.
Awesome.
I was at a place where you guys served the food and I was so impressed.
Yeah, nice. We love it. We love it.
Thank you.
That's yours, Ar.
Show that beautiful food. Gorgeous. Look at this
What
salad.
did you get?
This is the canyon salad, and that's the burger. So me and Ari are going to split halvesies. That's what sisters do, you know?
Right.
Love it.
Awesome.
Oh, great.
Man, they are crowded. What, they have 30 people
Yeah,
to
this
show
is
up?
amazing.
Must be somebody at a seminar next door at 7 degrees.
Oh, that's why. Yep, that must be. So, okay, good. So step number 1 is that.
Call the police.
Call the police.
2, make sure you get a copy of their insurance card and a copy of their license. Just take a picture of it with your phone. Step number 3 is if you feel out of it at all, don't drive home. Call your closest person to you so that there's somebody that knows, because if you've received a concussion or something like that, you don't want to be driving home. If you're not severely injured, just refuse the ambulance, because the ambulance is going to be such a huge bill. If you have a doctor of chiropractic, I would call them immediately. If you feel like you're significantly injured, you should go to the hospital. Make sure you get a copy of the hospital report before you leave. And next thing is start icing as soon as you can. One other thing is called the Arnica, Montana. You can go to the health food store and try to get the highest dose Arnica that you can. Also, there's a product called Traumeal. Traumeal is a homeopathic. You can rub that on anywhere you're injured.
That's a good.
And then start getting under care as quickly as you can and make it so it's a lot less of an injury.
Yeah.
What else?
So if someone were to be looking for care, and they've gotten into an injury, what would the process be like to start that care?
Well, you call your chiropractor's office, tell them you've been involved in a car accident, injury. Oh, and also make sure you call your insurance immediately. That was the other point. Call your insurance immediately so that they've got you listed as being in an injury. Even if it's your fault, whatever, just call. Call your doctor, let them know, get all your insurance information so they know. Oh, and here's one other thing. Call your insurance adjuster right now or after we get done and make sure that you have med pay coverage. You want medical coverage because that allows you to have money put aside for you to use if you're in a car accident, even if it's your fault. Because if you don't have med pay, then the provider, you're going to have to pay the provider to get the care and wait until the end to pay for it. And you don't want to have to do that. You've already been injured enough. So that's what med pay coverage. Don't let them sell you a policy without med pay. And med pay ranges from anywhere from $5,000 to $25,000 it's available. So take a look at getting med pay. Try to get the $25,000. It's not that much more. Just in case you're in an injury, then you don't have to worry about coming up with all this money to get the care that you need to get you back to pre-injury status and heal up. So that's my suggestion for you.
So how many people would you say you've treated after auto accidents?
I'm going to say 30 years, and I'm going to say between 5 and 10,000.
Whoa. 5 and 10,000.
I'd have to kind of do the math and estimate how many new patient auto accidents I've had, but since 1987, it's been 30 years.
Wow.
And we're always treating auto accident cases. We
Yeah.
always have auto cases that we're treating. So, and that's one of the things I specialize in. And there's a famous doctor. His name's Dr. Dan Murphy. That I've taken lots of certified whiplash training courses. Who's so amazing. His name's Dan Murphy, DC. If you want to go to his website, he's got all the information you would ever want. My wife and I have gone to many of his seminars, but there's a lot of research that's out there. Don't let anybody pull the wool over your eyes in terms of some of these things I've warned you about. So,
It's good.
anyhow,
So, yeah, that is a little bit about, whiplash, what goes on, and what are your basic first steps to do. We are always here to help if that is something that you've experienced and you're looking for care. We'd love to have you to help and balance and help you along that journey of healing.
okay.
And next week we're going to be talking specifically about what that healing looks like. We're going to bring some tools with us, show you kind of what the therapies look like to help heal that whiplash, and what that process of healing looks like. So join us next week for Lunch with the Doc to
Yeah,
get
some
to
practical
that.
stuff.
Some
What can be
practical.
done, how it's treated, that kind of stuff. But hopefully these two days have really kind of given you a lot more information than most people know in terms of how to treat it, how to heal from it if you've had a chronic one, and then go on from there.
Exciting event coming up. He was saying it's been 30 years, so we are celebrating our 30-year anniversary on December 1st. It's going to be amazing. We started the practice in 1987, Dr. Gary and my mom, Dr. Lisa, 30 years ago. So December 1st is going to be super fun. We're opening up our office all day. Whoops, it's a Friday. So from 8 a.m. to 2 p.m. we're having free treatment all day. So you can give us a call, get your little time slot, and come by for some treatment. We're doing adjustments, B12 shots,
B12 shots,
therapy.
free therapies, discounted foot detox baths, and then we're going to have a party afterwards from 2 o'clock to 5 o'clock. And you're invited to that, food, beverages, and then hospitality night that night. So
Yeah.
it's going to be fun.
It's going to be fun.
All right.
All right. Remember,
Signing off.
you are amazing.
You are amazing. See ya.
Bye.